Hello everyone, I am Chela Love. I'm a student with Maryville University in the Family Nurse Practitioner program. Today I will be completing my head to toe physical examination on Kamal. He's my volunteer for the day. Kamal was instructed to empty his bladder, his vital signs, his height and weight, his distance vision was checked via the Snellen chart, and Kamal was also instructed to take off his clothing and to put on a gown, which he has opted to put on his shorts. Okay, I will first begin my inspection by just checking his general appearance, his mood, seeing if there's any signs or symptoms of disease or distress. I will begin by assessing his head and his face. I'm inspecting his skin. I am noticing that his external characteristics are symmetrical. I don't see any signs and symptoms of infection. I don't see any irritation or lesions on his face. I will then focus my assessment on his scalp. I will move his scalp around. I see that it's freely movable. I will look at it from all aspects. I don't see any lesions. I don't see any nodules or bumps. Then I will then go and palpate his facial bones and his muscles, and then I will make my way to his frontal and his maxillary sinuses and ask him, Kamal, are you having any tenderness or pain in those areas?
No.
Okay, great. I will move downward to the temporal mandibular joint, and I will ask you to open and close your mouth, move it from side to side. Are you having any pain?
No.
Good. The joint is freely movable and there is no signs and symptoms of pain. I will then do light sensation with the cotton ball. I'm going to ask you, Kamal, can you feel the sensation?
Yes.
Okay. I'm going to ask you to close your eyes and you can tell me where I am touching.
Cheek. Chin. Nose.
Good. That was assessing Kamal's cranial nerve number 5, and it is intact. Okay, Kamal, clench your teeth for me. Shut your eyes. Open them wide. Wrinkle your forehead. Stick out your tongue. Push your tongue against my hand, against my other hand. Puff out your cheeks. Good. We are assessing Kamal's cranial nerve number 7, or his facial nerve, which is intact. I will then move my assessment and assess Kamal's eyes. I'm looking at his external eye, which includes his eyebrows, his eyelids, his eyelashes. I'm looking for any redness, any abnormalities, any signs of irritation or infection. I'm also looking at the even distribution of hair on his eyes, around his eyes. I will now start by inspecting his sclera, and his conjunctiva. I'm noticing that there is no redness, no drainage, no irritation. I don't see any yellow coloring. I will also palpate around the lacrimal apparatus. Are you having any tenderness around your eyes? Good. Do you have any issues with your eyes, such as dry eyes at any time? Okay, good. I will now assess his pupillary response, and that is assessing cranial nerve number 3. I'm looking for pupillary response to light. I'm looking for reflection of his cornea. I'm looking for accommodation, and I'm looking for direct and consensual constriction of both pupils. I'm going to move a light in front of your eyes, and I just want you to fix your eyes to a point on the wall behind me, and I'm going to check for his pupillary reaction. Great, and both pupils restricted, and they both showed accommodation. And I'll also do the cover and uncover test if I think that I had an issue with any light reflex. Come on, I'm going to ask you to put one of your hands over your eye. Okay, and drop that hand and put your hand over the other eye. Great. I'm looking for any drooping, any lazy eye, and I will now come a little bit closer to you, and I'm going to check for any extraocular movements by assessing his cardinal fields of gaze. Okay, Kamal, tell me when you see my hands.
Now. 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 Now.
Good. Now I want you to follow my fingers. Good. That is accessing cranial nerve number 2, 3, 4, and 6, which are intact. Okay. Now I am going to move to Kamal's nose. And I'm sorry, I'm going to go to his ears first. I'm sorry. I'm going to go to Kamal's ears, and I am inspecting his ears. They are symmetrical. They are right about midpoint on his eyes. They are in great position on his head. I am palpating the auricle of the ear. I'm noting any tenderness, any drainage, any irritation, any nodules that may be behind the ear, which is normal. I would then, with an otoscope, look in the ocular canal, or the extra auditory canal, I'm sorry, and look to for his tympanic membrane. And now I will be assessing Kamal's cranial nerve number 8 by doing the whisper test. I'm going to just stand at your side. You don't have to get me, cameraman. Kamal, take one of your fingers and wiggle your finger around in your ear and tell me what I'm saying.
Funny.
Good. Kamal could hear that word funny just fine. And at this time, I'm actually going to pretend like we are doing the bone and air conduction test by using a tuning fork. If I had a tuning fork, I would place it on the top of Kamal's head and ask him, does he hear the same in both ears or differently? And once he told me the same, I would know that that was a normal test. I would then take the tuning fork and place it at his mastoid bone. Once he tells me that he can no longer hear that, I would place the tuning fork on the side of his ear, and any normal air conduction would be that the bone conduction is heard longer at 2-to-1, at a 2-to-1 ratio. Okay. Now we are going to inspect, the air conduction is 2-to-1. That is greater. I'm sorry. Now we're going to look at Kamal's nose. I'm checking the structure of the nose. I'm checking symmetry of the nose. I'm checking for any abnormalities. I'm looking for any lumps or lesions on the nose. I am noticing that Kamal's nose is symmetrical. The septum is midline. I don't see any deviations on his nose. And now I'm going to check for patency. Kamal, I'm going to ask that you just close off one of your nostrils and breathe in. Good. And cover the other nostril and breathe in. Great. His septum, I'm going to check that with a light. And I'm also going to be checking for the mucosa, the turbinates. I'm just going to look inside your nose here, Kamal. Great. I don't see any nasal polyps. I don't see any abnormalities. His turbinates are a nice color. They're a light pink. And now I'm going to move down to his mouth and his pharynx. I'm looking at Kamal's externals. His lips are nice and moist. I don't see any dryness, any lesions on his lips. I'm going to actually put on some gloves. I'm going to be inspecting the inside of his mouth. I'm going to be looking for, first I'm going to palpate around his mouth and ask, do you have any tenderness?
No.
Okay. If you would open your mouth for me, I'm going to be inspecting his gums, his teeth. I'm looking for color, abnormal color. I'm looking for any dental caries. I'm looking for the number or any missing teeth that he may have. I'm also inspecting his tongue. If you will stick your tongue out for me. Okay, if you could raise it up, I'm going to look underneath the tongue and make sure that there are no lesions, there are no masses, no abnormalities under the tongue. His tongue is nice and pink. There is no coating on the tongue. We have to make sure that we are assessing underneath the tongue really well, because masses do like to hide underneath the tongue. And I also will look in his mouth and check his soft and hard palates. I'm also looking at his, say ah and bring your tongue down, his uvula, his tonsils, and his posterior pharynx. And I'll also check the gag reflex. Come out, I'm going to take this tongue depressor and I'm going to check for your gag. Say ah. Good. Kamal's gag reflex is intact. Great. I'm going to move on down to Kamal's neck. I'm looking at Kamal's neck from all aspects, making sure that his skin is nice and intact. There's no irritation. And I'm also going to check for Kamal's jugular venous distension, making sure that I don't see any visible distension. Of course, if he was laying on a 45-degree angle, it would be more visible if this was something that was a concern, which it is not. I'm right now going to do range of motion, so I'll ask you to tilt your head up and down for me, side to side. Okay, push your head against my hand and against my other hand. Good. Shrug your shoulders up and down. Shrug your shoulders against my resistance. Great. This is testing cranial nerve number 11. And now I will palpate Kamal's neck. I am feeling for tracheal position. His trachea is midline. There are no deviations. I will push the trachea to the side to feel the thyroid. Great. I will now have him swallow. Great. I will now inspect his lymph nodes, and I will begin at the pre and the post-ocular lymph node. I'm feeling his occipital lymph node, his tonsillar lymph node, the submandibular, and the submental lymph nodes. I will palpate his superficial clavicular, his posterior clavicular, his deep cervical lymph nodes, and his supraclavicular lymph nodes. I will also palpate his carotid arteries one at a time. And I will also listen to his carotid arteries. And I also listen over his thyroid, checking for any bruits or thrills. Sounds great. I will now inspect his upper extremities. I'm inspecting his skin, his arms, his hands. I am palpating those, making sure that he doesn't have any tenderness. I'm looking at his nail characteristics. I'm doing a capillary refill. And I will also inspect his brachial and his radial pulses. Okay, now Kamal, I will have you swing around the table for me. I'm going to check your back and your posterior chest. I'm going to inspect and just look at the skin. I'm looking at the thoracic configuration. I'm looking at his spine. I'm also looking at his respirations, seeing respiratory effort. And I'm going to palpate and percuss along the costovertebral angle, side to side and systematically. Checking for sound or for dullness. And now I'm going to check for expansion about his 10th rib down. I will put my hands and I will ask him out, take a deep breath in and out, again and out. Great. I am noting the expansion, making sure that my fingers are evenly and that they are expanding evenly with respiration and exhalation. I will now test for a tactile fremitus. Kamal, can you say 99?
99.
Again?
99.
And again.
99.
Absolutely, great. And now I will percuss the posterior and lateral chest. and we're gonna do this side to side. Systematically making sure that we're getting the same sound. Checking for dullness. Okay. And now I'm gonna actually listen for his diaphoretic excursion. So Kamal, would you take a deep breath in and blow it out? Good. And then take a deep breath and hold it. Good. I was listening for change in sound for his diaphoretic excursion, and his was between 3 and 5 centimeters, which is a normal finding. Okay. And now I'm going to auscultate the posterior and lateral chest, comparing both sides, doing that in a systematic side-to-side fashion. Come out, take a deep breath, and blow it out. Again. 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 Excellent. Sound clear. Okay, you can go ahead and face me again. Now I'm going to move to his anterior chest. I'm going to inspect his skin. I'm making sure that everything is symmetrical. I'm looking for his respirations again and his respiratory effort. I'm inspecting and notating any pulsations that I may see, any heaving. I'm also going to palpate the chest wall. You having any tenderness, any discomfort there?
No.
Great. I also palpate the precordium. I'm also going to palpate the apical pulse, checking for any heaves or thrills. And I'm going to palpate, all right, just palpated the apical pulse. Now I'm going to check for tactile fremitus. Come out, can you say 99?
99.
Again.
99.
And again.
99.
Great. Now I'm going to auscultate his breath sounds, the length of the lung field all the way down to the basis. I'm going to do this systematically and side to side. Take a deep breath for me. In, out. In. 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 Again. And again. Great. Now I'm going to go ahead and listen to his heart sounds. I'm going to first listen to his aortic. Take a deep breath for me and exhale. I'm going to listen to the pulmonic. Herb's point. The tricuspid. And the mitral. I'm listening at this time for any murmurs, any extra heartbeats, or any arrhythmias. Okay, come out, and now we're going to do your abdominal exam. I'm going to ask you to lie down. Thank you. At this time, I'm inspecting Kamal's abdomen. I'm inspecting his characteristics, the contour. I'm looking for any pulsations or movement. I'm looking for the ease in which he laid down with his strength. And now I'm going to start by auscultating his bowel sounds. I'm going to auscultate all 4 quadrants. This may take up to 2 minutes. If no bowel sounds are heard, Kamal has active bowel sounds. I'm looking for hyper or hypo bowel sounds. I'm looking for any hyperresonance. And while I'm listening, I will also listen to his abdominal arteries. I'm listening for the aorta, the renal arteries, the iliac artery, the femoral arteries, great. And now I'm going to start with my percussion. I'm going to go over to Kamal's liver borders, percussing over the liver. Now I'm percussing around his spleen and percussing around the bottom of his abdominal cavity. And then we're going to start with the palpation. Do you have any tenderness?
No.
Okay. Okay, I'm going to do some deep palpation. Actually, feeling for the liver and the spleen. Okay. Feeling for the right costal margin of the liver and the left costal margin of the spleen. And if he was having any issues here, the flank pain where his kidneys would be. All right, I'm going to have you raise your head. Good, and at this time I'm looking for any hernias that may be present. And Kamal has excellent muscles and everything is within normal limits. While he's lying down, I'm going to move towards down his feet and his legs. I'm assessing his skin. I'm assessing his hair distribution and his muscle mass. I'm palpating for temperature. I'm checking for edema. And I will palpate his dorsalis pedis pulse, his posterior tibial pulse, and his popliteal pulse. Okay, Kamal, you can go ahead and sit up for me. I've actually already been conducting the neurological exam throughout this examination. The cranial nerves, the sensation were all checked earlier throughout the exam. And now we're going to do his musculoskeletal. As he arrives from the table, I was inspecting his strengths. I was inspecting how he rises from the table, the movements. I will now assess his reflexes. I will assess here for his brachial reflex, his patellar reflex, great reflexes, his Achilles reflex, and Kamal, we're going to do some muscle exercises. Put your arms out. Don't let me push your arms down. Good. Don't let me push your arms up. Excellent. And now, Kamal, I'm going to ask that you stand up for me. Do a single squat for me. Good. Now face the wall for me and bend over for me. I'm looking at his cervical and lumbar spine. I'm looking at it at its entire length. Do you have any areas of tenderness in your spine?
No.
Great. Everything looks like it's in excellent position. Stand up for me. And after I finish my assessment, I will tell Kamal my findings about the assessment and the exam, and I will answer any questions that he has for me. Thank you for watching.